Thank you for all joining the first public meeting of the National Academy of Medicine's Action Collaborative on Countering the U.S. Opioid Epidemic. I also want to give a special welcome to those who are on the live webcast, and thank you for taking time to join us today. I'm Victor Dzau. I'm the president of the National Academy of Medicine. I chair this particular Action Collaborative with my co-chairs, Admiral Brett Dzau, the Assistant Secretary of Health at U.S. Department of Health and Human Services, Ruth Katz, the Director of Health, Medicine, and Society Program at Aspen Institute, and of course Jonathan Perlin, the President of Clinical Services, Chief Medical Officer at HCA Healthcare. Their leadership and engagement is really very impressive, and it's evidence of a one-of-a-kind public-private partnership in this Action Collaborative. So we have intentionally chosen representatives from the public, private, and nonprofit sectors to chair this collaborative to highlight the unique nature of this group and to serve as a reminder that reversing the trends of opioid epidemic will require collaboration and input from all of us from many different sectors. So here they are. Great gallery of their pictures, but you see them later on anyway. And here's the agenda. So quickly, we will have a keynote speaker presentation and Gary Mendel, CEO of Shadowproof. The beginning will be myself and Admiral Dzau, who in fact will open the meeting for you to bring you up to date on the issues. Gary, of course, will present how and why Shadowproof was formed, the work they're doing to combat stigma around addiction, and to highlight some of the key areas this collaborative should and can focus on as our work over the next 2 years. So we then have a short coffee break, as you can see, and we'll reconvene at 10:30 to hear a presentation from 4 working groups. The working groups are part of this Action Collaborative, and you'll hear the work specifically on the various areas which I'll mention very briefly. They're led by co-leads of each working group, and after the presentation, we have a reactor panel of field experts who provide comments, suggestions on the work of the 4 working groups. We're really looking forward to hearing from them. Last session of the day, we open the floor for in-person audience here, an audience who's watching via webcast. Steering committee members and working group co-leads will be available to answer any questions you may have, consider any comments that you might have. At 1 p.m. we adjourn the open meeting, and then the Action Collaborative working groups will split into small working groups to consider what they heard for the last 2 days, and then incorporate all your comments and suggestions into the work going forward. So throughout the meeting, I hope you join the conversation on social media, as you can see here, hashtag Opioid Collaborative, right here. And so I just want to introduce the subject, as you hear from Admiral Dzau on many of these statistics. He has certainly more up-to-date numbers than I do, but as you can see, the opioid epidemic is one of the largest, most complex public health threats and crises our country has ever faced. 130 Americans die every day from an overdose, and thousands more struggle with the burden of addiction. So many organizations, and particularly credit to the federal agencies, have responded to this emergency, and there's a good wealth of work going around. They're authorizing guidelines, frameworks, analyzing protocols, education material, and so on and so forth. Now, so why do we need an Action Collaborative? Because all these excellent solutions too often are not connecting with each other, and sometimes they work in silos. So the information is not always shared. And because this crisis is so complex, there's so many factors to consider and so many stakeholders in place, we at the National Academy decided that we should have a place, encouraged by many of you, to have a place by which we can all interact, coordinate, and find areas for collective solutions and collective actions, which is why the existence of this Action Collaborative. So this is what happened. Starting in January 2018, we had a brainstorming session, particularly with Ruth Katz and Aston Institute, to look at how we can facilitate more cross-sectoral coordination and help create cohesive, comprehensive strategy. This meeting was attended by leaders and representatives from a variety of stakeholder groups, including health systems, education, accreditation organizations, providers, and the provider associations, federal and state government, payer community, nonprofit, and others. And so this conversation validated the need for Action Collaborative. Following that, we had an informal stakeholder survey to get additional input into priority areas that we believe that collectively there's an opportunity to work together. And so, as you can see, this informed our planning meeting, which is held in last July, and this meeting really brought together the key stakeholders to say, let's move forward and to develop solutions on 4 areas: education and training, prescription guidelines and evidence standards, prevention, treatment, and recovery services, and of course cross-cutting research data and metrics. And now, to begin with, this collaborative, as defined, involves key organizations that come together, and you can see there's 55 organizations that joined the collaborative at the very beginning. They become the backbone of this collaborative, and in order to move forward, we create a steering committee and, of course, 4 working groups. So the steering committee is made of people in this room and on this slide, and I've already introduced my co-chairs, who's done an outstanding job enabling, guiding this work forward, and of course moderating yesterday's discussion. We had many sponsors, as you can see, and 17 sponsors altogether that help us engage and provide resource for this collaborative. They are also working either in the steering committee or one of the working groups, and I sincere thanks for all of those who are supporting this initiative. Now, so as we launched this, we had so many interests from so many people, so we decided what we should do is create a network organization. So the collaborative is now a network in addition to the core group and the steering committee, because this network allows many of you being connected to what we do, and of course us connected to what you do. And in yesterday's conversation, where there's an issue of implementation, particularly long-term after the collaborative, to me it's essential that these network organizations bring their forces to the table to implement long-run the changes. As you hear from Admiral Dzau, we should be going from today a crisis response to a more sustainable framework, particularly dealing not only with opioid, but larger issues of addiction. So I'm happy to say over 100 network organizations have joined us, and we will obviously reach out to you, keep you informed of what's going on, and probably create, in fact, a hub, knowledge hub, as we did in another collaborative, to keep everybody informed, but also learn from your best practices. So 100+ organizations have made commitments, and their statements are now live on our website. And you also see copies of press release sent out today at 9 a.m. to announce this major milestone. So this 100 organizations committed to working together to advance many of the issues that you care about, to address the whole issue of the opioid. So you please continue to join us, because it's not done yet. We're open to more interest, and this in fact is you can see, you can visit our site, but also complete a survey, keep name of your organization, a brief statement of commitment, and of course contact information for the future. I want to end by telling you that this collaborative extends throughout the national academies. We have indeed a whole series of other activities going on, which you heard, some of them heard yesterday afternoon, reporting back as this coordinated approach in national academies. We had, in fact, a committee on medical medication-assisted treatment, which is now called medication-based treatment. Adam Leshner told you about the important findings. We have an evidence-based clinical practice guidelines, which is now for acute pain, which is ongoing. We have several others, as you can see, of studies which are going to be released, and they'll be very helpful to many of us in moving this issue forward. So, I think this slide just emphasized the issue is very complex, and it involves so many different stakeholders, involves so many different sectors, and in order to be successful, we need to bring everybody together. And so I would say that first, thank you for being here. We all care about this issue very, very much. I'd say to all of you for putting all that effort into trying to make a difference, and of course to the U.S. government led by Admiral Giroir in terms of really moving us forward. And so with that, I would like to ask Jonathan and Ruth to stand up, the two co-chairs. You've seen them in picture, now you've seen they're real, they're here.
We're here.
And of course, I'll turn over to my co-chair, Admiral Giroir.